Hey there, welcome back to How to Medicate and welcome to this new video on how to use Alprazolam, also known as Xanax. This video is part on a video series on mental health problems, and for those of you that want to keep on learning, check out the playlist in the description after watching this video, of course. For those of you meeting for the first time, my name is Raoul, I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewer, because I believe that medically educated people make healthier decisions, which is the whole point of this video and my entire channel. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and if you're looking for medical advice, always contact your own doctor. And now quickly, let's get learning. As mentioned, the generic name of this medication is Alprazolam, but it's sold under several brand names like Xanax and Niravam. And it is available as a tablet or a modified release tablet. Which brings us to how to use this medication. If you want to use it, make sure to swallow the tablets whole with half a glass of water. Considering the duration of use, it's often discouraged to use Alprazolam for more than 2 months straight, as this can increase your risk for becoming dependent on this drug. This means you might experience withdrawal symptoms when you stop taking it. There are some exceptions though, where Alprazolam is prescribed for 6 months up to a year. Therefore, always discuss prolonged use with your doctor. Now, Alprazolam is part of a group of drugs called Benzodiazepines, and it can be used to treat several anxiety disorders like a panic disorder, social phobia and general anxiety disorder. Which brings us to what dosage should you use. And here it's important to note that you should always use the prescribed amount and frequency your doctor gives you. This is important because specific dosages can differ depending on the specific indication, the symptoms you're experiencing and your side effects. However, commonly doctors prescribe an initial dose of 0.25 to 0.5 milligrams 3 times a day for adults using normal tablets. If necessary, this dose can be slowly increased up to a maximum of 3 milligrams per day, divided over several doses. When prescribing modified release tablets, a common initial dose would be 1 milligram per day divided in 1 to 2 doses. Now, Alprazolam is a very effective drug, but unfortunately it can have some side effects. I will discuss some of the most common ones in this video, but if you're looking for a complete list, always ask your doctor or check your leaflet. Very commonly it might cause sedation, somnolence, depression, memory impairment, headaches or constipation. Commonly it can cause a decreased appetite, confusion, disorientation, blurred vision, nausea and chest pain. And uncommonly it might cause anger, aggression, hallucinations, muscle weakness and physical or psychological dependence. Which brings us to the safety of use. First of all, be careful when combining Alprazolam and alcohol, as this might increase its side effects. Furthermore, as mentioned, Alprazolam might cause dizziness, confusion, etc. If you experience any of these symptoms, then please be careful with driving and preferably don't do so. And lastly, Alprazolam might have interactions with other drugs you're taking. Therefore, always discuss this with your prescribing doctor. And as always, we're ending this video off by taking a look at the safety when pregnant or when breastfeeding. Research shows that occasional use of Alprazolam in low doses could be safe. This is true for pregnant women and women which are breastfeeding. However, there are some exceptions, so always discuss these with your personal doctor. Now, I hope this video was helpful and I hope you know now how to use Alprazolam. If you have any questions, let me know in the comment section and I will do my best to answer all of them. For those of you that want to keep on learning, check out the playlist in the description. And please, if you did enjoy the video, leave a like. This will help out the channel tremendously. Consider subscribing so you never miss such an awesome medical video again. And for those of you that can't get enough, I'm posting a few times per week on Instagram at How to Medicate. You can find me there. Thank you all, and as always, I will see you next week with a new video. Bye bye.